Welcome you all to the Vanguard Mental Health Summit, third edition, happening live at the Civic Center, Lagos, Nigeria, as a part of the activities in marking the World Mental Health Day 2025. My name is Merolake Ademichu, and I'm going to be your red carpet host for today. And alongside with me, I have my amazing co-host.
Ololade Adeomi. Today we gather with one powerful goal to raise awareness, break the silence and take action in response to the rising tide of suicide and addiction in Nigeria. The theme for this year's edition is Taming the Rising Tide of Suicide in Nigeria. It couldn't be more timely if you ask me. We'll be speaking with special guests, leaders, keynote speakers, mental health professionals and participants united in their drive and save lives. We will also discuss their expectations for the summit and their perspective on how we can our role in promoting mental health and preventing suicide in Nigeria. Stay with me.
So while we're waiting for our special guest, let's go speak to some of our keynote speaker. So stay tuned. It's going to be educative. It's going to be impactful. It's going to be aspiring.
Good morning, sir.
Good morning.
Experience in the public health space. How urgent is the mental health crisis? And what is the current status of mental health in Nigeria as of today?
Well, my name is Dr. Kingsley Akinroye. I'm the Executive Director of Nigerian Heart Foundation. Mental health is one of the prominent non-communicable diseases in Nigeria, and it's been growing, especially since 2011. And worked on it, and eventually brought it in as one of all globally. But in Nigeria, the problem, like we said, is growing because we know that 75% of the problems of mental health and Nigeria centrally. A lot is unknown. The one we are discussing today is suicide. Between almost about 60,000 members of the population die from suicide. And that is the one that is even quantified. Quite a lot are not known in terms of the data. So it's a very growing problem, and it transcends all parts of the community, and especially we also know that it's also mostly related to poverty and low social.
That truth and justice reign in peace of mind, and this we come to hand unto a banner without stain. It's our one request, our nation, then no prayer, with peace and plenty, Nigeria may be.
Thank you. You may be seated. So good morning again, distinguished guests, advocates, colleagues, journalists, and friends. Today we gather not merely for another conference or symposium, but for a conversation that could save lives. We're here to confront an uncomfortable truth that behind the smiles on our streets, behind the hustle and bustle of daily life in Nigeria, too many hearts are quietly breaking. Too many of our sons, daughters, friends, and colleagues are fighting silent battles with despair, addiction, and the haunting thought that life is no longer worth living. The harsh reality is that suicide is no longer a distant tragedy. It is here, in our homes, our schools, our communities. And when we add growing epidemic of addiction, whether to substances, screens, or coping mechanisms that numb rather than heal, the crisis often deepens.
Okay.
We're witnessing a dual storm.
How do we do it now?
One that destroys the body.
No, I am here because of my. So you understand me? Yeah.
But today is not about despair. It is about the courage and collective
Oh, okay, don't worry, I'll call your attention to me.
We're here to unmask, to remove the veil of stigma, shame, and silence that has kept too many from seeking help. We're here to speak truth to a crisis that thrives in the dark. Hence, we stand together, professionals, survivors, advocates, and citizens, to say that no more silence, no more shame, no more lives lost to what could have been prevented. So this gathering is both a call to compassion and a call to action. So let us listen, let us learn, and above all, let us leave this place determined to build a Nigeria where mental health is not a luxury but a lifeline, where every person knows that it's okay to ask for help, and that hope is real, and that help is near. Thank you, and welcome all. So very quickly, I'd like to welcome to the podium the editor of Vanguard newspapers, Mr. Eze Anaba, to deliver his welcome address. Please put your hands together for him as he comes.
Good morning, all. Distinguished guests, esteemed panelists, valued partners, mental health professionals, advocates, and friends of Vanguard. You are welcome. On behalf of the management and staff of Vanguard Media Limited, it is my honor and great pleasure to welcome you to the third edition of the Vanguard Mental Health Summit, a gathering that over the years has become one of Nigeria's most respected platforms for dialogue, awareness, and advocacy of mental health. When we convened the first edition of this summit in August 2021, our goal was clear: to create a space where experts, policymakers, and everyday Nigerians could come together to confront the stigma surrounding mental health and chart practical solutions for a healthier, more compassionate society. Today, 4 years later, that vision continues to grow. And your presence here is a proof that conversation is not just continuing, but gaining critical momentum. Yet, while many of us are working tirelessly to shine a light on mental health issues, developments elsewhere continue to make that work even more challenging. Just last week, the World Bank reported that about 139 million Nigerians are now living in poverty, an increase of 9 million from the previous figures. This harsh economic reality inevitably pushes more people to the edge, and sadly for some, it may lead to the painful conclusion that life is no longer worth living. Of course, mental health challenges are not driven by economic hardships alone. But what is common across many cases in a growing global recognition that mental health must be taken seriously. That is why the word empathy now resonates more than ever around the world. In many developed nations, suicide is approached with compassion and care. Sadly, here in Nigeria, our laws still criminalize suicide attempts. This is why a bill aimed at decriminalizing suicide is currently navigating its way through the National Assembly. It is our hope that today's session will produce resolutions that contribute to accelerating this long overdue change. As a nation, we must understand how deeply mental health affects our families, our workplaces, and our communities. The pressures of modern life, economic uncertainty, insecurity, trauma, and social isolation continue to take a toll on our collective well-being. Yet in the midst of these challenges, we see resilience. In those who speak up, in caregivers who give us so much of themselves, and in mental health professionals who serve often under difficult circumstances. At Vanguard, we believe that journalism is not just about reporting events, but about driving social change. This is why we remain committed to spotlighting mental health as a national priority, one that affects everything from productivity to public safety, education, and family life. This year's summit, themed Stemming the Rising Tide of Suicide in Nigeria, with the sub-theme Substance and Silence, Unmasking the Dual Crisis of Addiction and Suicide, reflects our collective resolve to move beyond awareness into action. It challenges us to find sustainable solutions, improving access to care, strengthening community support systems, and integrating mental health into both primary health care and national development strategies. We are deeply grateful to our partners, sponsors, and stakeholders who have supported this initiative from its inception. Your commitment reinforces the truth that mental health cannot be tackled by any one sector alone. Progress requires partnership. We also thank our distinguished keynote speakers, panelists, and facilitators who have graciously accepted our invitation to share their insights and experiences. Your contribution today will not only inform policy but inspire new perspectives on care, inclusion, and empathy. As we begin today's conversation, I urge all participants to engage openly, listen deeply, and contribute meaningfully. The ideas exchanged in this room can help shape this kind of society we all hope to live in. One where no one feels ashamed to seek help, where every life is valued, and where mental health is rightly seen as essential to overall well-being. Let me close by saying this. Mental health is not a luxury. It is a necessity. It is the foundation of productivity, of creativity, of peace of mind. When we invest in mental health, we invest in the strength of our people and the future of our nation. May today's celebration inspire new partnerships, fresh thinking, and lasting change. Thank you. And once again, welcome.
Thank you very much, Mr. Anaba. Just to recognize a few guests and dignitaries who have found it, important to grace this very important event and occasion. I'd like to first especially welcome the chairman of Vanguard newspapers, Mr. Sam Amuka, who just walked in. I'd like to recognize Dr. Akinroye. Should be somewhere around. Put your hands together for him, sir. the keynote speaker, Professor Taiwo. Professor Taiwo Sheikh. Okay, Professor Taiwo Sheikh. Please put your hands together. The NAFDAC Director for Narcotics and Control of Substances, somewhere here. Please put your hands together for her. Who else do we have here? We have Professor Akin Oshibogun. Please put your hands together for him. Of course, Mr. Liman Wali, Mrs. Titi Tade, Dr. Okay, I mentioned Dr. Kingsley Akere, Mrs. Deborah Omoge, Mr. Sam Ferraro, and Mr. David Agata, all from the NIMR. Please put your hands together for them. All right, so I'll quickly welcome for the chairman's opening remarks. I'd like to welcome the Executive Director of the Nigeria Heart Foundation, Dr. Kingsley Akere, for his opening remarks. Please put your hands together.
Good morning, distinguished ladies and gentlemen. It's a very great opportunity for me to stand here and be part of this summit. First, let me recognize the chairman, Papa Samamuka of Vanguard newspaper, a media that has been in the front line of public discourse in Nigeria. Sir, it's a pleasure for me to see you again and to join this summit. Congratulations to you. And what I'm saying also will be also for all Nigerian population. I also want to thank and recognize the Vanguard Media Nigeria team and as address from the editor, which was just found. Vanguard has been the paper and also the organization in Nigeria that has taken a very unique position in public discourse, taking the lead in every aspect and dimension of the Nigerian moving forward. So congratulations to all of you and those that are making us proud. Distinguished members of this oral thank you to join this. What we are discussing today I remember and how what you used to say in the 70s and is still reverberating. Because of that, it's a leading non-communicable disease. And I give you a little bit of the background to this. In 2011, the UN General Assembly only recognized 4 diseases: cancer, cardiovascular disease, diabetes mellitus, and thoracic disease. By chance, I was part of the discussion. Mental health was just nowhere to be found. And that means globally, the discourse on mental health was far, far at the background. Despite the fact that every community, tiny, however tiny it is, has the burden of mental health. So, the discourse continues in all zones of WHO. And I remember very well also in WHO Afro, the resistance to bring mental health as part of disease to be recognized by WHO. Subsequently, I want to thank your team and your forefathers, those in the mental health arena, who never gave up. So by 2018, mental health became recognized as an entity and as a disease. When WHO then included it in the mental health agenda of the NCD, highlighting the need for continued de-stigmatization, improving the clinical training, and giving a forum for access to essential medicines, which is quite a move and a positive one. Thereby raise globally the awareness of mental health. By 2021 August, 10 years after the UN General Assembly in New York on the non-communicable disease after recognition, Vanguard Media Limited took the lead again and launched the first ever mental health summit, probably in Africa, was certainly in this part of the region of Africa in Nigeria. Vanguard Media Limited for breaking again the public discourse. And today, we have 3.0 edition for the Vanguard Mental Health Summit, which has gathered all of us here together. The Vanguard Mental Health Summit series has progressed from improving knowledge, mobilizing leadership, and fostering collaboration at all levels to identify or to the identification of drug abuse as a vital factor in driving mental health crisis in Nigeria. The array of distinguished speakers that are here today from all sectors of the stakeholders shows the progress and a determination to make a change in mental health. So we will not be disappointing the UN for recognizing mental health as a disease entity that needs a lot of ramifications and dedication, especially for those of us in the developing world. Today, the focus of this summit is on suicide as a growing public health crisis. So we are really in public health crisis, and we can only save ourselves. Globally, suicide claims more than 720,000 lives each year. And like all non-communicable diseases, nearly 75% of these deaths occur in low and middle income countries. So, if you have the appropriate data, we will be able to know that even what we have is still just beneath the table. Available data says Nigeria ranks 6th globally among countries with the highest suicide rates. Thereby, Nigeria records an estimated 16,000 suicide deaths annually. And strikingly, in the ages of between 15 to 29. That is where you have the base of our population. You see. though several cases of this are still unreported and undocumented, as though that data is a challenge. Yet Nigeria is faced with a suicide crisis that is predominantly hidden behind two S's: stigma and silence. In consonance with the World Mental Day 2025 key messages, I understand this summit, amongst others, will focus on one, breaking the stigma, advancing discussion around the decriminalization of suicide, like we have just been told earlier. I also understand that there are very few countries in the world that have done this. And if it's going to be done more, we in developing countries, we need to stand right. Nobody's going to do it for us. As we know that most of our population are still unreachable, despite the fact that all of us are trying to contribute. I do also know that this summit is also going to encourage open conversations among multi-stakeholders, promote awareness about mental health issues, and like you know what to say when the first summit focus on awareness, but both for communicable diseases and non-communicable diseases, and all over the world, awareness is still a challenge. So if we are able to cross that, move forward, then we will have done more. And certainly, Vanguard is doing that. Also, we are going to examine ways to ensure accessible and inclusive mental health for all, from primary health care level, strengthening management at the secondary health care level, and also the tertiary level, where, of course, discussions have been doing by in terms of the resources we have at the tertiary level, both the human resources and the infrastructural needs that we need to move the discussion forward. We also need to focus on vulnerable populations, older adults, persons with disabilities, refugees, and of course, you know, what we have been going through in the past almost a decade. There are growing populations of refugees in our community. So we don't know that mental health also needs to be part of the care of those populations. And of course, the TB populations of the youth that we call the Gen Z. Highlighting the vulnerability of youth to social pressures, mental health struggles, and economic hardships. Hopefully, we will provide supportive environments that create safe and healthy working environment in schools, in the communities that support mental well-being. Again, Nigeria must actively domesticate and influence the scientific evidence that most suicides are preventable with timely, evidence-based, and often low-cost interventions at the community level. So we must also look at that, like I did mention, I still feel the relevance of having community interventions. Especially we have known this in talking about non-communicable diseases, that tackling non-communicable diseases, the community interventions are the ones that have really worked all over the world. So for the stakeholders, I believe that is an area that we should also focus on. It's nice to discuss at this level that we are talking to each other. We do our research, we do policies, we make all what we can do, but until we get to the community, at the community level, these are where the people that need our discussions are. And hopefully, we also must foster life skills for these young people. People in the bracket of 15 to 29 that I've mentioned, where you have the concentrations of suicide there. And don't you forget that in our own environment, you know this better than me, that the backbone of community support has broken down. And when this has broken down, what we still need you need formal structures. When you have formal structures at community level, then that is the way forward. It is nice to mention primary health care, that we have been saying this since, of course, the time of Olukore. But I work in the community, I work in the state, and I do know that we still need to do a lot. It is not only the structures that we need. We need the human resources at the community. And we do not need highly trained personnel. We need to go out of the box to find our own people that are going to bring forth driving this message for a lot of what we are discussing today. Finally, I want also to express appreciation to the Vanguard Media Limited for what you have been doing, especially in the area of your public discourse. I know that my organization, we are in the area of cardiovascular health, and we have been doing this for the past almost 35 years, working with your team, and we are proud of what Vanguard newspaper has done in cardiovascular health. We hope we'll be able to achieve this. Sam, the Ferrari is here today, the first health editor, when we started the journey of cardiovascular health. The challenge can be achieved when we all work together. We know collaboration is the word, and partnership. Nobody can do it alone. The least organ that can do it alone is the government. And the one that can do it mostly are the NGOs. Do not forget the NGOs. Thank you very much.
Please, another round of applause for that powerful opening remark. Let me quickly recognize Mr. Majekutumi Oluyinka. Please put your hands together for him somewhere here. I'd like to also recognize the founder of CTISA Global, an initiative on substance abuse, Dr. Martins Agugi. Please put your hands together for him. Sorry, I have a very good grasp of Nigerian names, but the handwriting here is not doing me justice. Let me recognize the Director of Media and Advocacy for the NDLEA, Mr. Femi Babafemi. Please put your hands together for him. I'd also like to recognize the Commander of the NDLEA Lagos, Commander Abubakar Liman Wai. Please put your hands together for him. I also have here Mrs. Pamela Ajayi, who is the chairman of Bridge Clinic and Doctors on Air. Please put your hands together for him. And I have Dr. Ramatu Momodu, who is the Director of Narcotics and Controlled Substance, representing the DG of NAFDAC. Please put your hands together. Okay. All right, now, so to a special remark by special guest of honor, Senator Asuko Ekpeyon, who is the chairman, Niger Delta Commission, representing Cross River South Senatorial District at the National Assembly, who is ably represented by the senior legislative aide to the President of the Senate, Mr. Edem Eko Basi, who will be delivering the remarks on behalf of Senator Asuko. If he's here, please put your hands together, please.
Good morning, distinguished ladies and gentlemen. Permit me to stand on the existing protocol. My name is Adam Bassi. Gentleman has already largely done the introductions. I'm here on behalf of Senator Super Payom, who is unavoidably absent. And I'm going to read his remarks. I'll begin. Good morning, distinguished ladies and gentlemen. I am deeply honored to have been invited as a special guest at this year's Vanguard Mental Health Summit. I thank the management of Vanguard for their vision and consistency in sustaining this important national conversation since its first edition in 2021. This summit, now in its third edition, continues to give a voice to those in the shadows and build bridges amongst advocates, experts, and lawmakers. The theme of this year's event, Taming the Rising Tide of Suicide in Nigeria, is unfortunately quite appropriate as thousands of Nigerians continue to die by suicide. Every 4 seconds, somewhere in the world, someone takes their own life. In Nigeria alone, about 16,000 people die by suicide each year. A staggering and heartbreaking reality. These are not just numbers, but lives that could be saved with compassion, care, and timely action. It is this conviction that led me to sponsor the Suicide Prevention Bill 2024, a legislation that seeks to decriminalize the attempt of suicide and rehabilitate and reintegrate integrating individuals who survive suicide attempts alongside the provision of mental health and psychosocial support for relatives of those who died by suicide or survived the suicide attempt. The reality on ground, especially as highlighted by the summit sub-theme, is that we cannot address suicide without addressing the coexisting crisis of substance addiction. The challenge of substance and silence is one we take seriously. Too many young Nigerians in particular are trapped between despair and dependence. And our response must be both of compassion and comprehensive action. Under Section 327 of the Criminal Code and Section 231 of the Penal Code, attempted suicide in Nigeria is still considered a criminal offense, punishable by up to 1 year in prison. This outdated law does not save lives. It punishes pain. It deepens stigma, drives silence, and makes many more determined to complete the act. The Suicide Prevention Bill marks a historic shift from punishment to patient care, from stigma to support. Specifically, it seeks to mandate the establishment and proper funding of dedicated assessment and stabilization centers, ensuring that any individual who survives an attempt is immediately directed into professional care pathway rather than the prison cell. The provision for comprehensive rehabilitation and psychosocial support is designed precisely to intercept the dual crisis, offering pathways to recovery, not just from a suicide attempt, but from the underlying mental distress, often exacerbated by drug and alcohol misuse. I am proud to report that the Suicide Prevention Bill has passed its first reading in the Senate and will soon advance to the second reading with the support of my colleagues. With the support of colleagues, mental health professionals, and civil society partners. I want to express my profound gratitude to the Nigerian Mental Health Network, the Nigerian Suicide Prevention Advocacy Working Group, and the wider coalition of mental health professionals, civil society groups, and courageous survivors who have been educating me and working tirelessly behind the scenes. Your collective voice and dedication to continue to shape a more compassionate and responsive mental health policy landscape in Nigeria. As we gather today, I am confident that this assembly, filled with experts, advocates, survivors, and policymakers, will spark the ideas and partnership we need to save lives. Together, we can translate today's dialogue into action that reaches every community and every person in distress. As a legislator, I recognize that learning never ends, especially on issues as complex and deeply human as suicide and mental health. This summit presents yet another opportunity for me to listen, to learn, and to draw from the wealth of expertise and lived experiences gathered here today. The insights to be shared in this room will continue to guide my legislative efforts, ensure the laws we craft are rooted in empathy, evidence, and the realities of our people. Let us end the silence, open the doors to care, and build a future where seeking help is a sign of strength, not shame. Together, we can make suicide not a sentence, but a story of survival and hope. I thank you all, and I wish every participant a fruitful and successful summit as we work together to chart a new path for mental health and suicide prevention in our nation. Thank you.
Thank you once again, sir. And we do hope that the bill that the distinguished senator is sponsoring, finally gets to become law. All right, so I have 4 distinguished guests who will deliver goodwill messages. We're allotting about 3 minutes each for each of the goodwill message. I'll please crave indulgence of each and every one of these guests to please try to stick to the allotted time. So for the first goodwill message, I'd like to welcome Dr. Olufemi Oluwatayo, who is the founder of the Retreat Hospital. I'm a general adult and rehabilitation psychiatrist and a fellow of the Royal College of Psychiatrists. Please put your hands together for him as he comes to the podium.
Distinguished guests, ladies and gentlemen, thank you for the opportunity to be part of this conference. Thank you to Vanguard newspaper for what you've been doing in the mental health space. It's not always that we have the opportunity to speak to the national discourse. I think Vanguard is doing a great job to give us that opportunity. So we really appreciate it. Thank you. I'm a psychiatrist. I'm based in the UK, and I also have a practice in Nigeria. We've been going on at the retreat for 7 years, 8 years now. 2017 we started, and we also have a practice in Ikeja, GRA that we just opened, where we're doing TNS. I have done a lot of work in the field of suicide and mental health. I actually wrote a book with one of Nigeria's finest journalists, Martin Ifije. It's called The Morning After. I've got a copy here. It's about prevention of suicide in Nigeria. Suicide is a very complex subject, as we all know, because for somebody to decide to take their own life, they must have gone through a lot for that to happen. So prevention of suicide, it's on different level. We have individual level, we have society level, and we have government level. I think we have to be honest with ourselves. The government is very important in everything we do. As individuals, we're really trying to do our best, but we need the government to lead the way and do the right things. I'm really pleased that the senator is actually passing this law. I mean, this law is so archaic. It was 1962 or something that this law has been around, criminalizing suicide. I think that's unacceptable in 2025, because we know that suicide is a result of many challenges that people are having, and they should be criminalized. So thank you, Senator, for what you're doing for us. I think there are a lot of policies that the government can do to help us to prevent suicide. First of all, let them manage the economy well so people can have money in their pocket. Poverty is a huge problem in terms of suicide. They need to put policies in place to prevent means of suicide. What are people using to kill themselves? There was a time they were using sniper. I think that's probably, I've not heard much about that lately. So I think they need to put policies in place to reduce accessibility to means of suicide, so you don't have access to them. So things like that has been done in developed countries where you don't have access to paracetamol or to gas to kill yourself, things like that. They can do policies to help us to manage the access to the means. And then when it comes to individuals, we know that we can do manage our mental health better, sleep, to relax, to do exercise, not to eat bad stuff, not to smoke cigarettes, to have a rest. So a lot of stuff we can do as individuals. Then it comes to society. How much are we supporting ourselves? We should be kind to ourselves. We should be considerate. We should listen to each other. We should support each other. So society has multi-layer of causes and prevention. Now we're talking about substance misuse. As we all know, our youths are having access to all this stuff online, and they're copying all that and making all these drugs. It's an epidemic in Nigeria. What are we doing about it? In fact, the government again needs prevention. They must do something to tackle this in the public health space. And maybe individuals now do what they can do about it. Resilience, are we doing that talking about young people? What are they learning? So we can tell about these things one step at a time together at different levels. So I think I'm really pleased for everybody to be here. Thank you for what you're doing, and thank you to all my colleagues sitting down. I've seen a lot of people I've not seen for a long time today. So nice to see you all. Thank you.
Thank you very much, Doctor. I think that we can all agree with you that credit alerts are indeed therapeutic, and it's a very important booster for our mental health. Let me quickly recognize Dr. Esangbedo Arit, who is ably represented by Dr. Okay, she's representing. Okay. She's representing the medical director for the Urban Psychiatry. Please put your hands together for her. All right. So for the next goodwill message, it will be delivered by the former Chief Medical Director of LUTH and the first chairman of the Mental Health Summit, Professor Akin Oshibo. Please put your hands together for him.
Your Excellencies, as we sat down, I watched Uncle Sam walking, and I pray that when I grow up, I want to be like you. This is a man who is committed to a cause, because at his age, he doesn't need to be here. He will afford to stay in the comfort of his home and be enjoying a cup of coffee or a cup of red wine, whichever one he chooses. But he's still here because he believes in the cause. Thank you very much. About 13 years ago, while I was still the Chief Medical Director of the Lagos University Teaching Hospital, a patient died on the ward, and it was going to become a scandal. Why did this patient die suddenly? even though he was ill, but then we didn't expect that he would die, but he had committed suicide. End-of-life decisions can be a cause of suicide because the patient had concluded that there was no need to waste further family resources. So he decided to end it all so that the family would stop spending money on him. I'm drawing our attention to that so that we know that it is not only use and abuse of drugs that lead people to commit suicide, and we need to pay attention to all those issues that lead to depression. I'm sure the experts are here. I will not be giving a lecture on that, but those issues are real. Suicide is real, and I must commend the Vanguard newspapers for leading the front. This is the third summit, and I'm sure that they will remain committed to it, and it is a task for all of us to jointly cooperate so that we can reduce the incidence of suicide. At the Lagos University Teaching Hospital, following that incident, we decided that every patient that was coming in with serious or severe illness would be screened so that we will watch them, so that we don't have patients dying or not when they shouldn't die. And I think that led to a project called Suffering. I'm sure that Ms. Tade will be speaking more about that later. I thank you for inviting me. It's a pleasure to be here. Thank you.
Thank you very much, sir. The next goodwill message will be delivered by the founder of the Global Institute of Substance Abuse, Dr. Martins Agwoke. Please put your hands together for him.
The chairman, please permit me to stand on the already established protocol. As was rightly introduced, I'm Dr. Martin Abuja, a global expert in substance use prevention, treatment, and recovery. Let me thank Vanguard for organizing this very important event. As we all know, there is a crisis of substance use and abuse in Nigeria. I am therefore not surprised of the suicide figure. Studies have made us to understand that risk factors for substance use and suicide or suicide ideation, they are very much related. Which means if we want to address the issue of suicide ideation or suicide, it simply means that we have to address the issue of substance use and abuse in Nigeria. How we respond to these risk factors goes a long way to preventing the next suicide. There are a number of risk factors. I want to believe the expert will discuss that in details. How we respond to them matters. Let me quickly share this. Just last week, one of my daughters, though not biological daughter, but she is under my care. And she sent me a message and said, Daddy, she's in university. She said, Daddy, I'm so tired and unmotivated, and I don't want to do anything again. And unfortunately, because of the restriction in the university, there was no way I could speak with her. And what was my response? I said, so sorry, my darling daughter. I can understand. Please just relax, take time to rest. You will be fine. Love you. At that point, I didn't know what she was going through, but I also needed to minimize risk because anything ordinarily could have happened. And for one who may not be very conscious, may choose to respond in different ways. Some parents might just say, if you are tired of going to school, please pack your things and come back home. Some could actually say, you have started this your madness again. That will just be the response. Some may say, especially that she is not my biological daughter. I am doing for you what your biological parents could not do for you. And you are sending this stupid message to me. These are some of the ways we complicate issues. So the bottom line is that we should not minimize early warning signs. So whether substance use or abuse, suicide, and others of us have said, the risk factors are very much related. We should not minimize them. How we address them, they are very important, and we all have collective roles to play. Talking of this young girl, daughter of mine, in some cases, parents, adults, tend to believe that it's only we, the matured ones, parents, that are going through stress. But I tell people, human beings, we start going through stress even from the day of birth, which means we should not make it look like or think that the young ones, they don't go through stress or issues that can put them, both psychological, emotional, and physical, that can put them at risk of suicide. So on this note, once again, Vanguard, I appreciate inviting me and other guests here, and I look forward to hearing from the experts. Thank you.
Thank you very much, sir. Take the lesson of being compassionate and having kind words when people express or demonstrate being under stress. For the next person, I'd like to welcome Dr. Machagodumi Oluyinka, who is representing the MD of the National Psychiatric Hospital, Aro, Abeokuta. Please put your hands together.
The chairman of this occasion, distinguished guests and speakers. I'm here on behalf of my Provost and Medical Director, Dr. Paul Agbola. He has asked me to bring greetings from the management, staff, and patients of our hospital. Our hospital is no doubt the foremost psychiatric hospital in the country and beyond. I know some of my senior colleagues will be contesting that, but they actually can't contest it, because for you to be a great psychiatrist in this country, you must have dealings with the neuropsychiatric hospital Aro. The program of today is a very significant one for everyone. When I say everyone, I mean everyone, because primarily we are dealing and discussing the issue of mental health. And the issue of mental health is what's concerned every one of us. It's either because we have friends, family members, colleagues, and other people who have mental illness. If I say I have a relative who suffered mental illness, and you say you do not have, I would like to say that we have originated from the same source, from Adam and Eve. And so if I have a family history of mental illness, then you also have it, either remotely or directly. So it concerns all of us. And when we talk about the issue of suicide, have we considered it? I know we have asked ourselves, what is the value of human life globally? Of course, it is unquantifiable. But if we consider the happenings globally in this current period of our existence, we will realize that it appears that we do not have put much value to human life. And for someone to decide to take his or her own life, it means that the situation the individual has found himself is overwhelming. And this situation confronts a lot of people, a lot of us, at some time or the other. So it's a very significant issue. And for those who have lost one person or the other to suicide, either as colleagues or as family member, it may be a difficult experience. It might not be something that one can understand if we are not exactly in their shoes. Suicide is very common beyond the figure that we are made to have. And it is said that in our environment particularly, it is underreported due to a lot of factors. Suicide is a phenomenon that occurs in every part of our community, even in institutions. Apart from health institutions like that we mentioned, it also includes, of course, mainly psychiatric institutions. But we must also look beyond that. Let's look at our own correctional institutions as well, where some of us also work. And of course, studies from all over the world has indicated that the commonest cause of death in the prison is suicide. And there are a lot of people who are mentally disordered, who are offenders within these institutions, whose offenses sometimes have been as a result of the mental illness that they have primarily. Of course, some of them become mentally ill as a result of their incarceration in the prisons. And there are a lot of these people who are languishing, who do not have the adequate and the required care that they deserve. And of course, our new law, the National Mental Health Act of 2021, is taking care of these aspects. But the implementation is still very minimal. A lot still needs to be done. A few days ago, we had the news of clemency that was given to a lot of people. But we have people among this list who are primarily suffering from mental disorders, who are at risk of suicide, who could also benefit from such pardon for them to receive the care that they need. I want to thank you for having us here, and I want to congratulate the organizers for this beautiful gathering for this discussion. Thank you very much.
Thank you very much, sir. So let me just quickly invite to deliver a very important presentation on behalf of the Director General of the NDLEA, Brigadier General Mohammed Buba Marwa, ably represented by Mr. Femi Babafemi, the spokesperson or the spokesman for the NDLEA for his presentation. Please put your hands together. want to start by recognizing and appreciating our leader. We call him Uncle Sam. Thank you very much, sir, for being here. We'd also like to appreciate the chairman of this occasion, as well as the guest speaker. Our friends in the media, distinguished invited guests, my colleagues from the NDLA, unfortunately, we came prepared for a topic, not exactly what we have here because of what was communicated to us, but then trust the chairman chief executive of the NDLA. He touched quite a lot of areas that are closely related to the topic, so I will then arrange that with the organizers, with my colleagues, and then we'll have to look at substance abuse, addiction, suicide, and mental health, NDLA's role beyond enforcement. Before I go for that, please permit me to specially recognize an alumnus of the NDLA and Dr. Martin. I don't know if you are still the president of ISOP. Nevertheless, as at my last check, he was the president of ISOP Nigeria. Please, thank you very much for seeing you there. Last week. All right, thank you very much. What I'm about to read is definitely the paper prepared by the Chairman Chief Executive of NDLA, Brigadier General Mohammed Buba Mara, retired. And so every word coming from me from this paper should be attributed directly to him. They are not my words. Distinguished guests, esteemed colleagues, participants at this noble summit, ladies and gentlemen, it is my privilege and honor to address you today at the 3rd Vanguard Summit Mental Health. I bring you warm greetings from the National Drug Law Enforcement Agency. Before anything, allow me to express my sincere appreciation to the organizers of this vital summit. For 3 years, the Vanguard has remained steadfast in raising national awareness on mental health, demonstrating each year a keen attention to the various dimensions of this pressing social issue. This year's theme, focusing on suicide, brings us to a conversation about deeply important issue, one we cannot afford to ignore in our society. With over 16,000 deaths by suicide reported annually, it is a matter that demands sober reflection. We must discuss it openly to identify ways to address and curb this tragic phenomenon. I thank Vanguard for providing a platform for dialogue and policy formulation on this critical issue. My presentation, like I said, skipping the initial topic given to us, but then speaking on all of these issues, but then NDLA's role beyond enforcement, which lies close to my heart, that the chairman's heart, in truth, shape the future of our national response. For long, the NDLA has been viewed principally as a law enforcement agency recognized mainly for interdictions, arrests, seizures, and prosecutions. Indeed, this constitutes the core
of our statutory mandate as clearly set out in the NDLA Act. Yet there exists a quieter, less publicized dimension of our duty, which has grown in urgency in recent years. As an anti-narcotic agency, the scourge of drug abuse and addiction and the attendant mental health crisis has compelled us to balance our strategy such that we not only act as enforcers of the law, but also as agents of healing, prevention, trust, and community resilience. In today's Nigeria, we speak of drugs, addiction, and public health, mental health issues in the same way. We now understand addiction as a chronic relapsing disorder, a condition that carries the grave risk of overdose, comorbidity with mental health conditions such as depression, anxiety, and psychosis, as well as infection, all of which can also lead to suicide, as has been stated earlier. Our understanding wasn't so deep some 3 decades ago. Our understanding then was limited, confined largely to the realm of criminality. Today, Nigeria is confronted with profound challenges arising from illicit drugs. Our nation bears a threshold burden as a producer, a consumer, and a transit point. With 14.3 million of our compatriots abusing illicit substances, Nigeria is grappling with far-reaching consequences of substance abuse, which places immense strain on families, young people, communities, and the health system at large. Given the enormity of this problem, we must pause to reflect and ask, what is the true place of law enforcement in all of this? The answer is plain. The purely punitive model has revealed its limits. Arrest without treatment, incarceration without rehabilitation, and enforcement without prevention merely keep us running in circles, while the problem grows ever larger. Yes, indeed, since the establishment, and more so in recent years, the NDLA has made significant strides in drug control, seizures, and public education. However, the growing consensus, both in Nigeria and across the world, is that drug control cannot be divorced from public health challenges, such as the suicide and mental issues we are discussing here today. We must therefore rethink the old model and seek evolving and pragmatic approaches to address this complex challenge. Therein lies the imperative of repositioning NDLA's role as a partner in health, in communities, in prevention, in harm reduction, and in social healing. That brings me to the essence of rethinking the NDLA and envisaging its evolution beyond the body of enforcement to a partner in community and public health. What does beyond enforcement mean? What does beyond enforcement mean in practice? It means integrating demand reduction, harm reduction, prevention, treatment, rehabilitation, community outreach, and education into our core strategies. To expatiate further, beyond enforcement entails recognizing that the fight against drugs is not won through arrest and seizures alone, but through building trust, reducing stigma, intervening early, and supporting recovery. This means that the NDLA must embrace a more holistic, humane, and evidence-based approach, working in close collaboration with public health agencies, mental health professionals, civil society, and the communities themselves.
We must recognize that community policing is not merely a tool for crime control. It is a philosophy, one that demands engaging local communities, earning their trust, collaborating with them to develop solutions, listening to their concerns, maintaining a visible presence in neighborhoods, and intervening at an early stage. In the past 4.5 years, the NDLA has undergone a transformation that has strengthened our capacity to fulfill various aspects of our mandate, particularly those relating to drug control and public health. However, for the benefit of some of our guests here seated who may be wondering how the work of a drug law enforcement agency aligns with the principles of community policing and public health, I would like to skip some of these points because they may not totally be buttressing what the current situation here. Okay, as we brought up kinetic operations, it is the sphere of civil activities such as community policing that the NDLA cannot operate alone. Consequently, we rely on partnerships with a wide range of allies, both at home and abroad, in the context of community. Our partners include mental health and mental health agencies, talking of federal and state ministries of health, psychiatric institutions, and NGO. We focus on mental health for training, referral, and treatment. Also, public health agencies, NAFDAC, and the Pharmacy Council of Nigeria, among others, for co-designing surveillance, data linkage, and comorbidity monitoring. In fact, we signed an MOU with NAFDAC in November 2024. The education sectors, talking of schools, universities, and vocational institutions, civil society, faith-based organizations, and community groups, international partners, UNODC, INL, HYO, and other security agencies, media, and community platforms. Now, in synergy, NDLA becomes a node in a network of health, social security, and community actors. Under the National Drug Control Master Plan 2021 to 2025, NDLA has the mandate to engage more with demand reduction and public health strategies, which further broaden our engagement with communities. I wish to outline several key efforts that will advance and enforce the NDLA's role in the years ahead. Just last week, there was a national conversation by the Nigerian Academy of Science in the form of a stakeholders workshop themed Cannabis Oil Debate, the Path Forward for Nigeria. The workshop brought together policymakers, regulators, medical experts, and scientists, among others. The outcome, no doubt, will further contribute to the policy and reforms required to ensure the safety of the mental health of members of our society. There has also been a review of the NDLA's Act to reinforce both public health mandates, not just punitive powers. We are expecting the conclusion of the legislative process on the amended Act anytime soon. Part of our reform has focused on the strategic use of data. Until recently, the only comprehensive data on drug abuse in Nigeria came from the National Drug Use Survey report of 2018. The findings from the survey have galvanized the nation into adopting a more active and coordinated approach to tackling drug abuse. The findings of the survey spurred the resurgence of the NDLA and informed the last National Drug Control Master Plan, that's the 2021 to 2025, which will be ending at the end of this year. However, as of today, that data has become dated and there is an urgent need for an updated survey. Efforts towards conducting a new national drug survey are already underway alongside the formulation of a new NDCMP 2026 to 2030. As an agency, we have been actively and systematically collecting data from our various operations. This process has enabled us to map patterns of drug use across Nigeria, a task we shall continue to pursue as we expand our reach and deepen our presence within communities nationwide.
We have equally invested substantially in intelligence gathering as a core component of our reform, not merely to track drug trafficking networks, but also to serve as an early warning and surveillance system for substance use and related mental health comorbidities. As the next phase of our reform, we shall in the months ahead scale up our community policing through the deployment of NDLA community liaison officers in every local government area. These officers will work in close partnership with local structures and stakeholders. One of our flagship community initiatives is the Alternative Development Program, targeting cannabis growing communities across the country. This program is set to be piloted soon in Ondo State. The Alternative Development Project demands ethical responsibility and commitment to develop transformative policies and humanitarian responses to mitigate drug-related problems and end the complexities and violence of the war on drugs in Nigeria and globally. In Nigeria, the Alternative Development Project will focus on reducing vulnerabilities of ignorance, poverty, hunger, unemployment, and underdevelopment that push people into illicit economies, particularly illicit drug cultivation. At the same time, we are steadfast in our public communication efforts to reduce the stigma associated with drug abuse. In this regard, we seek to destigmatize addiction, simplify stories of recovery, and emphasize health over punishment. Our WADA, that is War Against Drug Abuse Social Advocacy Initiative, has served as a key platform for engaging community leaders, some of whom have become WADA ambassadors working alongside the agency to reshape the public narrative. As I mentioned earlier, the NDLA is undergoing a profound transformation. At its conclusion, we aim to become not merely a shield against drug trafficking, but also a partner in healing, prevention, and the strengthening of community resilience against the scourge of illicit substances. In conclusion, I leave you with a vision, a Nigeria in which NDLA is not feared but trusted, not simply a polity force, but a healing one, not a distant arm of government, but an embedded partner in every community, where enforcement and empathy work hand in hand, and where prevention, treatment, rehabilitation, and community engagement are as central as addiction. The burden of addiction and mental health is far too great for any single actor to bear alone. We need one another. The NDLA, the Ministry of Health, mental health professionals, civil society, local communities, the media, the private sector, all of who are seated here. Each of us collectively. This summit is unlike any other. As we take strides forward, we must ensure that our gatherings do not become merely annual conversations. Each year, we must engage with resolutions. We must emerge with resolutions robust enough to ignite bold partnerships capable of shaping policy and driving resolute action. I thank you for your attention. May the hearts and minds converge in service of human dignity, community safety, and the health of our nation. God bless you, and thank you for listening.
Please another round of applause for him. And I'm sure that I speak the minds of many when they commend, your boss, for the excellent work that he's doing to prevent substance abuse in this country. We are solidly behind him, and we hope that he succeeds, because his success is a collective success for this country. Thank you once again, sir. So for a very short goodwill message before we go to the keynote, I'd like to quickly welcome the principal partner of Datasphere, who is also the immediate past president of Healthcare Federation of Nigeria and the creators of Doctors on Air radio program, Dr. Pamela Ajayi.
Distinguished ladies and gentlemen, please permit me to stand on existing protocol. I'd like to commend the Vanguard of both passionate and let compassion struggling in silence. Silence keeps people struggling and suffering, and the stigma keeps them hidden. And I just want to mention briefly this about the stigma, because the stigma is so deep in our society about mental health. And I do a lot of work with young people, and so I speak to young medical students, nursing students, etc. And at one of these forums very recently, I brought up the topic of mental health, and you would not believe the silence. In this generation, which is supposed to be a vocal generation, a generation that is speaking about issues and all that, the stigma was so strong. The silence spoke volumes. So I believe that by unmasking this dual crisis, we are breaking the silence. And I want to appreciate this for pushing out that message, because it is so important. And as we gather here today, the important voices that are in the room, I want to appreciate the work done by the NDLEA. I love the, my heart was warmed by the humane message that came from that, drug enforcement agency. It was sincerely appreciated. And I would like to enjoin all of us today as we work together to actually each one of us become a catalyst for change and compassionate action. We need to make sure that we are committed to action. It's not enough to sit here and have that conversation, but we need to go out there to listen, to support, and to build the systems that are needed to offer hope and healing. And I'd also like to ask or invite anyone that is present here today that is interested in coming on my radio show, Doctors on Air. Doctors on Air actually airs on Classic FM every Wednesday at 9 a.m. And we have between 5 and 10 million listeners. If you want to have a platform to speak, please just speak to me so I can give that opportunity to broadcast this message even further. I believe that together we can stem this tide and make Nigeria a place where every life matters and every mind is valued. Thank you very much.
Thank you very, very much, ma'am. Clearly, we must take mental health very, very seriously. I mean, I remember recently I was in Kano with a colleague of mine. We had a meeting with this very important trader in the Kano market, and I was stressed from the trip in Lagos, gone to see the man. Wearing a very, my face was all, and so he asked me, asked a friend, what's wrong with your friend? And my friend said to him, just having, so he asked me, what's wrong with you? I said, I'm just stressed, sir. He said, how? You are stressed? He said, yes. So how, are you married? I said, yes. He said, how many wives? I said, what's up? I had one now. So, you feel better. But he gave me a caveat. He said, that one that you had, the happiness will last for just 2 years. So prepare to add another one to balance it. So, to deliver the the keynote address, I'd like to humbly welcome a renowned psychiatrist, a policy reformer, an academic, a leader at the Ahmadu Bello University's area, who is a life fellow of the West African College of Physicians and international faculty of the Harvard Medical School. He has served as the president of the Association of Psychiatrists in Nigeria and medical director of the Federal Neuropsychiatric Hospital in Kaduna. He co-authored Nigeria's Mental Health Policy 2013-2023, the National Suicide Prevention Framework 2023, and the National Mental Health Act 2021. He's an advisor to Africa CDC. He also set national standards for substance use treatments, the founder of the Biological Psychiatry Society of Nigeria, and he mentors young specialists, leads genetic research on depression, and has over 80 publications. He's been honored with multiple awards, including Nigerian Physician of the Year, and he remains a leading voice in mental health advocacy across Nigeria. Please help me make welcome Professor Taiwo Lateef.
Can we have the slide projected? I believe my time is left to start counting. Let me align with the existing protocol, but I must especially recognize the chairman of the occasion, my leader, the chairman of Vanguard, our uncle. I also want to recognize my older brother who shines the path for many of us behind him, Professor Chibomu. I want to also recognize the Vanguard Musical Group, my colleagues that are here, starting with the former Vice President of the Association of Psychiatrists in Nigeria and other consultant psychiatrists that are here. Charity begins at home, they say. Eminent personalities that are here, my lords that are present here. This is an activity of the media, so I profoundly recognize the media. I want to thank Vanguard Group for inviting me again to talk at the Vanguard Mental Health Summit. I was telling my chairman of the occasion this morning that for me it's a personal fulfillment that mental health is being discussed in an open space and is being spearheaded by non-specialist mental health people. That non-specialists who constitute over 80% of people who are seated in this room and listening to us from all over the world are the ones in the forefront, the front runner for advocacy and awareness building for mental health in Nigeria today. Is a personal fulfillment for me. 20 years ago, I never thought that this could happen, but it's happening today. The entire mental health community is very grateful for all of you. I will start with some disclosures. The work I'm going to First, an academician, but today I'm standing as an advocate. So you will not see histograms or bar charts, you won't see graphs, you will just be listening to narratives. And that's what advocacy is all about. I won't bore you with P values. Secondly, the work I'm presenting is wholly my own work originally. And I take responsibility for every word that I mention here. Thirdly, I have no marketing interests. It's a purely humanitarian advocacy and awareness work. I am ready to share my work freely. So anybody who is interested in the slides, I'll give it to you freely so that you can disseminate it further. This is the scope of the outline of my presentation. And then I'll just quickly move to acknowledgements. It is important that I declare this acknowledgement, that I acknowledge the following. The souls lost to preventable suicide in Nigeria and all over the world, I want them to understand that the society actually failed them. Because suicide is a preventable tragedy. While I was writing for the Vanguard as a columnist in mental health conversations, one of my write-ups was on suicide, a preventable tragedy. It is really a preventable tragedy. Persons presently under the distress of thoughts of dying by suicide, please be assured that help is here today. Keep your hope alive. We listen to you as you are not alone. We care and we love you. Members of the Nigeria Suicide Prevention Advocacy Working Group, which many of them are in this hall, including members of staff of the Vanguard. Chuma is a leading figure within that group. We salute your sacrifices, your tenacity, your courage, and dedication to the main cause. But this is my acknowledgement. So let me just move in straight to share with you some are my experiences, some are things I did from the literature. Suicide everywhere is a preventable tragedy. We share our understanding that with effective intervention, social support and time, many who have tried to end their life or consider ending their life can go on to live full and meaningful lives today, unlike 40, 50 years ago. Therefore, concerted multidisciplinary and multi-sectoral efforts must be geared at tackling suicide in Africa and Nigeria, and it should include addressing mental health conditions and other social determinants of suicide, as has been said earlier. Because as we go on, next slide please. As we go on, we realize that suicide should not be trivialized into a single cause. It's complex and multifactorial in its cause. Basically, suicide refers to intentional self-inflicted death. But I can tell you that it is beyond self-inflicted death. Suicide is a situation where one is compelled, and when we say compulsion, it's beyond your control. A compulsion to end your life because of the weight of what you are experiencing. It is just not mere self-inflicted death. It's a compulsion. You get pushed to the wall to a certain extent that you have no other option. The only option you see is to exit. Believing that when you exit, things will be better for you, you'll be at peace, and things will be better for the people you are leaving behind. If you look at the numbers, we usually rate it per 100,000 of the population. And we are saying that people who end their own lives do not actually want to die, but feel there is no other option to relieve their pain. They want to end the pain and suffering. Sometimes they believe it will also end the pains of the caregivers or close relatives. So this is the basis of suicide. The psychologists, the clinical psychologists will tell you that there is a triad that you need to fulfill that will culminate in suicide. The pressure on you, the lack of fear of death, and the loss of experience of pain that comes during death. The moment you fulfill these three, then the gate is open for suicide. The pressure is so overwhelming, and you don't fear death anymore, and you don't feel pain again. Once you get to that point, then the gate to suicide is open. Next slide, please. When we look at the scope of the problem of suicide, suicide has attained crisis point globally. In 2012, United Nations declared suicide as a global crisis. 2012, 13 years ago. But most countries did not pay attention to it. And now it's catching up with us. 13 years ago, UN declared suicide as a global crisis. Nigeria is here to declare suicide as a global crisis. Despite the quantum number, we have had it over and over and over again of people who die as a result of suicide. 16,000. What other condition in Nigeria takes 16,000 lives every year? Tell me, is it Boko Haram? Is it kidnapping? Is it armed robbery? Is it road traffic accident? What other condition in this country is taking 16,000 lives every year? And yet Nigeria has not declared suicide as a crisis. The rate of suicide among young people is about 15.2 per 100,000 population. Multiply that by 62% of Nigerian population. Under 30s represent 62% of Nigerian population. So do the arithmetic and you'll understand how many young people under 30 are dying because of suicide in Nigeria every year. Every 33 minutes, a Nigerian's life is lost to suicide. Every 33 minutes. Count it. How many 33 minutes do you have in a day? That is lives lost to suicide. And yet, Nigeria has not declared suicide a crisis. That's why we are very grateful to Vanguard. Probably after today, it will filter to the right places and they will see reason to declare suicide as a national crisis. And all hands will have to be on deck. I don't want to bother you with these statistics. I think I've said much about it. Next slide. Next slide. Suicide is wreaking havoc. Suicide is the third leading cause of death among 15 to 29 globally, but on the African continent is the second leading cause of death, only next to road traffic accidents. Approximately 88% of adolescents who die from suicide globally are from low and middle income countries. Nigeria is in the belt, so you can imagine. Unfortunately, the availability and quality of data collected for suicide and attempted suicide leaves a lot to be desired. We know why. Criminalization of attempted suicide is not allowing people to come out. And even in the registry, people don't register death due to suicide as suicide death. Because if you register it, you have to submit yourself for investigation. That law does not only restrict help seeking, it also restricts support. The law that criminalizes suicide, attempted suicide, you go to jail if you are reported to the police. they prosecute you, you are liable to go to jail for 12 months. If you are aware and you fail to report, you are liable to go to jail for 4 weeks, 1 month. So the law does not only prevent service uptake, but also prevent support. Yesterday morning at 9:58, I received a text message from home. A 200-level student of sociology at Ahmadu Bello University jumped into the water. And everybody was looking for me. And from wherever I was making connections, calling this, calling that, to be able to save the life of the young man. Every day, every 33 minutes. For every death, about 20 to 25 attempted and failed. I'll bring that the Nigerian figure to you to see. For every one suicide death, 20 to 25 have attempted and failed. They are still struggling. Their fail doesn't mean that it has gone. They are still struggling. And if you fail once, the next time you are likely going to succeed. That in itself is a determinant for complete suicide that you have attempted before. So it's a serious problem. And I thank God I can see very heavy people in this hall. The senator is heavily represented. It will get to where it should be. Yes, next one, please. The threats of suicide in Nigeria. Nigeria has an estimated over 15,000, 16,000, 15,000 annual deaths from suicide, or 6.9. Just do the arithmetic yourself. 6.9 per 100,000 population in about 230 million people. That's what it gives you. So it's not, and this is another estimation, because this is just a WHO project. We ourselves, we don't have suicide data. This is the truth. Because we have no records, we have not done any survey. So we are relying on WHO projection. Added to this, for every death, it is estimated that there are at least 20 attempts, meaning that some 300,000 Nigerians in suicidal distress face the agonizing question of asking for help with added threat of the risk of punishment. 300,000 every year. You either go and ask for help or you go to jail. 300,000. An average of 6 persons related to someone diseased by suicide suffer mental health and psychosocial sequelae. Adding this together, about 450,000 Nigerians need support annually. This is what is there. It's a fact. Fact is truth supported by evidence, by data. This is a fact. Next slide, please. So, suicide remains a crime. These numbers are likely to be widely underreported, masking the potential scale of the crisis. Next slide, please. What are the risk factors for suicide? And this is very important for the media houses. Ethical reporting of suicide. We tend to trivialize suicide. We tend to just put everything in one basket. You read in the paper, a medical student recently at Ife was said to have died of suicide after failing MBBS exam. But that's what we are seeing. Do we know how he has managed to pay the school fees before failing the exam? Do we know how much food he's eating? Whether his parents are able to provide food for him in the school before failing the exam? Do we know what other things are happening to him? Whether he even suffers from depression that is untreated? Whether he's suffering from schizophrenia or he's using psychoactive substance? Do we know? But we just carry everything and say because he failed exam and trivialize it. Suicide is much more than that. So it's always good. They call me that a 200-level sociology student jumped into the well because they gave their reason. I said, wait, just send him to me. Don't tell me the reason, just send him to me. allow me to look for the reason myself. That is how it should be. Even if you are a caregiver, you don't have to be a psychiatrist. Don't just put everything in one basket. So these are things that I've given you here. Very importantly, the unmet aspirations of young people. The most vulnerable in our society are young men and women. They are the most vulnerable, under 30s. And by the time we go into the social determinants of suicide, we realize that the social determinant of suicide is all over the place. Dr. Ajumani, I recognize you, sir. Thank you. I didn't know when you walked in. Thank you. The unmet aspirations of young people. Today we know job, purchasing power. I want to be a lawyer, I can't. It's all over the place. Media influences, role modeling, wanting to meet up the expectations of the society and so on. Next slide, please. There is an intricate relationship between our mental health and the risk for suicide. Absolutely. You can't talk about suicide without talking about mental health. But suicide is not mental health. Mental health is part of suicide. Only part of suicide. Suicide is not everything about mental health. So let us know that, because a lot of people assume that once you hear anything suicidality, the person must have a mental illness. It is not true. Mental illness is part of suicide, but suicide is not mental illness. Please quote me today. Like I said, I'm responsible for every word I say here. Suicide is not mental illness, but mental illness is part of suicide. So there are people who are saying we should move suicide bill that is before the National Assembly and subsume it into National Mental Health Act. That is wrong. Because the objectives of the National Mental Health Act is about those who have mental illness. That law is for people under the burden of mental health condition. So if you subsume suicide prevention law into Mental Health Act, it means if you don't have a diagnosis of mental illness, that law will not protect you. That's what it means. And we tell those who are doing this that cannot work. Listen to us. We need a standalone, a comprehensive suicide prevention law in Nigeria that takes care holistically of anything about suicide, including post-prevention, care for relations of those who have died of suicide or attempted suicide, and the criminalization of attempted suicide. That is what the law should do, to set up fund for suicide prevention, address the social determinants of suicide among young people in Nigeria, provide jobs, support them in school. That is what the law before the draft before the National Assembly contains. Setting up a fund for suicide prevention, including access to that fund by those who have attempted suicide. When you identify their social needs, you draw from the fund to support them. Setting up suicide collection data. Where there is no data, there is no planning. And he who fails to plan has planned to fail. That is what the law that is in the National Assembly. How can you carry this and put in the mental health law? It makes no sense. It doesn't. I'm sorry I digressed a little bit, but it's something that is bothering me, and it's something about public health. 90% of suicide deaths are related to mental health conditions and substance use disorder. It's there. The data is there. Over 70% of such suicide-related deaths are due to mental health conditions are due to depression.
The social determinants of suicide and those of mental health conditions are not only similar, but they are related, even though they are not the same. Similarity is not same, and being related is not same. We need to understand that. Poor access to effective mental health services is a major risk factor, especially among young people. The mental health treatment gap in Nigeria is about 85%, which means only 15% of people with severe mental health condition access treatment in the past 12 months. That is what is called mental health treatment gap. So we have a lot of young people moving around with untreated mental health conditions. You can understand why the rate is so high among young people. They have no access to mental health care. It's not there. 15% in some communities in Nigeria is up to 95% mental health treatment gap. Only 5% of people who deserve the treatment can only access it. That is what it means. And that is fueling suicidality in our communities. Next slide, please. Experiencing risk factors does not necessarily mean the person will think about or attempt to take their own life. Often people who are considering suicide are dealing with a combination of mental health condition and difficult life events. The determinants of mental health conditions, like I said earlier, are similar and related but not the same. Next slide. We talk about social determinants and so on. I think it's important that people understand the meaning of social determinants. It's very important. Because if you don't understand, as a teacher, I know that if my student miss just one line out of what I'm saying, the whole of that lecture will just disappear. Social determinants are societal problems that disrupt optimal mental health, increase risk for and prevalence of mental illness, and worsen the outcomes among individuals with mental illnesses. Mental health and many common mental disorders are shaped to a great extent by the social, economic, and physical environment in which we live, including entering buses to go to work and returning from work, including flood, including disasters, including banditries, and so on and so forth. Social inequalities are associated with increased risk of many common mental disorders. But most importantly today, these social inequalities are very important as determinants of suicidality. It's a fact. We only need someone to remind us, but I am sure that everybody in this hall understands the influence and impact of social inequalities related to suicidality. Next slide, please. I will take us a little bit into mental health for us to understand it more, to be able to relate it well. The dimension of health we all know is physical, mental, and social. Arithmetically, it means our mental health is 1/3 of our total health. But the truth is, mental health is the foundation of all health. Despite the fact that it's not even giving up to 1/3, either in budgeting or in anything, it's not giving up to 1/3. But the truth is, mental health is the foundation, because your health, your well-being, your optimum well-being is predicated on your choices. You go for your health, you actively search for good health, and your search is based on your choices. You cannot make these choices in the absence of good mental health. It's impossible. You see someone walking on the street without clothes, ordering rubbish, eating from the dustbin. Where is the choice? So without good mental health, you can't make the choice. And that is why we don't just say it like that. When we say mental health is total health, it's not just guessing. It's the truth that we can defend. You can't enjoy optimum well-being in the absence of optimum mental health. This is the truth.
Our mental health is an aggregate of our emotional, psychological, and social well-being. All of them tied together. It affects how we think, how we feel, and act, and it also helps to determine how we relate to others and make choices and handle stress. The fact is, we all have mental health. Everybody has mental health. I must allow this to sink. Probably somebody is hearing me for the first time, so I have to allow it to sink. Everybody, God has endured all of us with mental health, which we need to promote, we need to protect, we need to preserve in order to prevent mental distress and mental illness. We all have mental health. A lot of people are in mental distress. Very few people are in mental illness. But every one of us, you must find a way to promote your mental health, which is God-given. You must find a way to preserve your mental health, which is your choice. And you must find a way to prevent mental illness, which is within your capacity. God has given you mental health. That one is free of charge. But all other ones are in your hand. And you must be seen to actively do things to preserve your mental well-being. And look at your neighbors, look at people who sit next to you, and ask them, how do you preserve your mental? No, ask yourselves. Go ahead. How do you preserve your mental well-being? Ask your neighbor. Ask yourselves. Say it into the eyes. Now, everybody has his own way of preserving his or her mental health. Everybody has. You can preserve your mental health in an adjusted, acceptable manner within your socio-cultural setting. You can also preserve your mental health thinking you are preserving in a maladjusted manner. NBLA will be able to tell you more how you try to preserve your mental health in a maladjusted setting. You have small problem, you rush to alcohol. It will make you forget it that time, but it hasn't solved it. Or you go and start smoking cannabis. Or you want to feel like you have won the prize, which you haven't, by going to take a sniff of cocaine. It makes you feel you're on top of the world, you have won everything. So you can preserve it in an adjusted, acceptable socio-cultural manner, or in a maladjusted manner. Mental health is one of the most neglected areas of health. We know that. All over the world, not only in Nigeria, but it is worse in this part of the world. Investment in mental health is very meager. Even international organizations that are supporting, granting money for things, they grant very little for mental health. It's true. The budget for mental health, Nigeria doesn't have a budget for mental health. It's true. They come, they tell you that, oh no, there is no budget. The truth is there is no budget for mental health. They spend money, but there is no budget. They spend money from Federal Ministry of Health, from State Ministry of Health, except Lagos State, Ekiti State, and today probably Kaduna State, that have created a directorate for mental health. They are the ones who design the budget for mental health. Where there is no directorate, there is no budget. So they find small money, they allocate, they say Federal Neuropsychiatric Hospital, they go to National Assembly and defend it. The quantum of the money they are giving the Federal Neuropsychiatric Hospitals, there is no subsidy for the patients there. It's all about payment of salaries, infrastructure, buy petrol for vehicle, and so on. But there's nothing that subsidizes medication or TMS or transport for the patient. Nothing for the patient. And this is, we are saying, the foundation of all health. Don't be deceived. There is no budget for mental health in Nigeria. Quote me. None. What they spend is just a meager 2 to 3% of the health budget for a condition that is the totality of your health. 2 to 3% of the national health budget goes to servicing institutions. It doesn't go to the patient. It goes to servicing the 10 neuropsychiatric hospitals. If you go to books, you see that 1 out of 4 or 5 people have a lifetime chance of developing mental disorder. But 1 out of 8 people at any point in time will have either symptomatic or syndromic mental illness. And in conflict areas like Nigeria, 1 out of 6 people at any point in time has a mental disorder. Next slide, please. I have something here that if I don't share it, I will not have peace. This is the dimensions of our health, mental health. You will see in green, optimal mental well-being. In yellow, or in amber, or pink, you see mental distance. And then in red, you see mental illness. You see there, oh, where do you go? Yes. Under it, you see a double-edged arrow, which means we are all oscillating within this spectrum, like a pendulum. Every second, every minute, every day, every week of our lives. Nobody is permanently fixated at any point, at any time. Even as we are sitting here, we are oscillating. Absolutely. Even as we are sitting in this hall, we are oscillating. At any point in time, we are shifting from optimal mental well-being to distress. If the distress is not properly managed, we go to mental illness. If we manage it well, we come back to optimal mental well-being. I'll give you the story of Mr. Michael, who had a grocery shop in Surulere in Lagos. There was the EndSARS riot. The man had been running his grocery store for over 20 years. He had built a house in the village. This is reality. He sent his children to school, put food on the table. The EndSARS riot, his shop was bubbled and everything was scattered away. He couldn't sleep, he won't eat, he stopped talking to people. He doesn't entertain visitors. The wife was worried. On a Sunday, she went to church, she confided in the pastor. After discussion, the pastor invited Mr. Michael. He went, they had discussions. 2 weeks later, the pastor invited them again and he came with someone, a member of the church, who recapitalized Mr. Michael and brought back his business. And he started functioning again.
He started talking to people, he was sleeping well, and life returns to normal. Mr. Michael was distressed, he wasn't sick. And they were able to catch him within the distress zone and return him to optimum mental well-being. If that had not happened, Mr. Michael would drift to syndromic depression, and suicide may be what will follow. That is the mental health dimension. It is not everything that is sickness. It is not everything that requires medicaments. The pastor did not give Mr. Michael medicine. We call it psychosocial intervention. The pink and the red zone are the suicide zones. If you are waiting for mental illness to say somebody is likely to die of suicide, then you miss it out. People who are distressed. Majority of people who are distressed are likely to take that pathway. So don't wait for syndromic mental illness. And that's what we're talking about. Next slide. I think I'll just wrap it up now. What is the approach to access to mental health and suicide prevention? Our approach is a public health approach. It's a whole society approach that targets young people. Next slide. The strategy that we use to present it, we are talking about taming the tide of suicide. Effective and sustainable mental health and suicide prevention strategy involves person-centered, community-based, and whole society approach. Next slide. When we talk about person-centered, we are talking about identification of people in need and enhancing access to interventions, both individually and as a group. And I have within this slide underneath, if you get it, you will see a breakdown of how we can implement this person-centered approach. But the main goal is to identify and to be able to enhance access to interventions to the individual. Next slide. And when we say community-centered, we are talking about community-based approaches involving community awareness and advocacy, targeting community leaders. This approach should also seek to address culture-based myths, misconceptions, misunderstanding, and stereotypes that leads to stigma towards mental health and suicide. Like communities where they don't bury someone who died by suicide and things like that. I also have under here specific interventions that you can do within the community. If you get the slides, I'm sure you'll see it. The whole society approach, next slide. The whole society approach is about whole society awareness campaign for adequate understanding and support for mental health and suicide prevention. Targeted advocacy campaigns to policymakers, lawmakers, and leaders in the society to recognize the need to prioritize mental health and suicide prevention. Formulate realistic and effective policies and strategic frameworks that are sustainable. Legislative framework that will empower policies and plans and remove the barrier for health scheme and support. I want you to understand that policies and frameworks are mere commitments. I will buy you shoe at Christmas. Then your sister falls sick. I take the money to take her to the hospital. Nothing will happen to me. But if there is a law that says that if I promise to buy you shoe at Christmas and I don't do it, something will happen to me. I will go and borrow money to take your sister to the hospital and make sure that I buy you the shoe. That is the relationship between policy and legislation. So we need legislation that will enforce the policy and ensure that if government doesn't do it, somebody can, God bless Garifawa, somebody like him will go to court and say there is a law that says my government should do this and they didn't do it. That will happen. Next slide. Addressing suicide crisis in Nigeria specifically, the approach must be strategic,
multidisciplinary and multi-sectoral, and multi-layered. That is clear, and I gave explanation. We must develop comprehensive, integrated, culturally sensitive, and all-inclusive, implementable and effective suicide prevention policies. Advocacy and awareness campaign that is whole society but specifically directed to address negative needs and misconception about suicide and suicide attempts in Nigeria. Next slide. Mobilize multi-sectoral and multidisciplinary civil society organizations to partner with respective government agencies and deploy toll-free crisis helplines that are ethical, compassionate, and technology-driven suicide intervention services to be operated by in-country CSO, not foreigners. People who know how to greet ourselves in Yoruba land, in Igbo land, not people from outside who will bring things that will disrespect our culture and traditions. Especially young people like being secretive. They don't like opening up. So I'm sure Dr. Arit is here. She can support what I'm saying, what SOPIC is doing in this country. Young people don't like opening up. So if you can leverage on technology for young people to have their voice, to be able to speak out to somewhere and seek help without anybody knowing, interfering, that is the best. Crisis helplines in the bedroom, you pick a phone and call. Only you and the receiver know what you are talking about, and they will de-escalate your crisis and refer you to the most appropriate place. You can use text message, you can use WhatsApp, you can use Facebook, Instagram. These are the things that we need to leverage on for young people to be able to prevent suicide among them. Next slide. So these are social and policy focus for Nigeria. We all know this. Addressing social determinants of suicide and mental health through effective social justice and economic reforms that is tailored towards poverty reduction and guarantee aspirations of the youth in the country. Next slide. Next slide. Next slide. This is just the story of we changing the narrative, discussing suicide not only as a moral issue, but suicide as a public health issue. What are we doing in Nigeria towards this? Go ahead. You can see this. The National Nigeria Suicide Prevention Advocacy Working Group is a coalition of civil society organizations in Nigeria that we set it up in February 2024. As at last year, we were 120 members. I think we have grown to almost 180 now. 32 civil society organizations are members of this group, including the Vanguard. Staff of Vanguard newspapers are very, very important members of this particular group. It is multidisciplinary, multi-sectoral. The philosophy is whole society approach, sections target, community-based and person-centered. And our activities initially were virtual workshops, webinars, but we had a physical conference in Abuja last year, October. What have we accomplished so far? We have increased visibility regarding suicide prevention in Nigeria. Most of this talk we are doing, we are pushing it from the Nigeria Suicide Prevention Advocacy Working Group. We have accomplished increased advocacy and awareness, and we have hosted a successful national conference, and we have a draft National Suicide Prevention Bill. We developed that draft, and that bill is being sponsored by Senator Asuku Ekwenyo at the National Assembly. It's gone through the first reading. Next slide. These are just examples of the things that the group has been doing. Next slide. And this is the national conference that we held. Next slide. Next slide. Yes. Oh no, back. Yes, you will see this is just page 1 of people who are speakers and participants during the conference. Next slide. What is our story of changing narratives of suicide? Attempted suicide, a desperate cry for help or an act of self-immolation, is criminalized under Section 327 of the Penal Code Act and Section 231 of the Penal Code Act, with offenders facing up to 1 year in prison in Nigeria. This needs to change. The very existence of this law serves as a stark reminder to those struggling with mental health and psychosocial issues that their suffering is not only misunderstood but condemned by the society. We also try to change the narrative by launching the National Suicide Prevention Day. Next slide. Our last advocacy meeting with Senator Apenyo, you could see him in the center, and these are some members of the advocacy working group, including the president of the Association of Psychiatrists in Nigeria, Nigeria Mental Health, Deborah is there, quite a number of people were there. Next slide. What is our key message regarding that law that criminalizes attempted suicide? Number one, it's very unfortunate that Nigeria still remains one of the 25 countries in the world that still has a law that criminalizes attempted suicide. I don't think it's something that is worthy of being proud of. That law is a colonial law. That law is not indigenous to Nigeria. Those who brought that law to us, they have seen how compassionate we are in Nigeria. They have copied our style. They have gone back to their country and changed it and left us with it. If your brother wants to jump to the lagoon, I'm sure you are not going to push him. But that law says you should push him. Yes, that's what the law says. These people have come, they dropped the law for us. At the time they did that, there was no prevention strategy for suicide. Today there is 1,001. That law is old, is archaic, is colonial, is something that reminds us of very bad experiences we had with colonialists. It attempts to stop the acts but does not stop the thoughts. And it doesn't address the determinant of suicide. It doesn't bring joy to young people. It doesn't increase their spending power. It doesn't support them in school. That law just sends them to jail. It attempts to stop the acts but doesn't stop the thoughts and neither supports them. It does not recognize that suicide is a preventable condition. It thinks that sending people to jail is the only way to stop them from taking their own lives. It's a barrier to help seeking and help support, like I said. But very importantly, that law does not allow us to generate data. And if we don't have data, we cannot plan. And like I said, if you fail to plan, you have planned to fail. Next slide. What is our take home today? With effective intervention and social support and time, many who have tried to end their life or considered ending their life can go on to live a full and meaningful life. Concerted multidisciplinary and multi-sectoral efforts must be geared at tackling suicide in Nigeria. Criminalization of attempted suicide establishes and perpetuates an environment where stigma is encouraged and deters the victims from seeking timely help because of the legal implication. Nobody wants to be called a criminal. When you criminalize something, then that is the foundation of the stigma. Because criminality is stigmatizing. So these are my parting words. I thank you very much. Suicide is preventable everywhere.
Thank you very much, sir. That was That was a knowledge-filled presentation, and thank you very much, sir. So we'll take a 5 minutes. I'm not sure whether to call it a break, but I'd just like to quickly welcome Mr. Tony Obani, for a bit of teaser before we take it up from where we were. Where's Mr. Tony? You're here already. Alright, before Mr. Tony comes up, let me quickly probably recognize the AIG of Zone 2, Onikon Lagos, Mr. Kayode Adepoki. Thank you for joining us. We also have with us here Dr. Tolu Ayobade, who is the Director Speed Down Project Mental Health and representing the Commissioner for Health, Lagos State, Professor Akiyaba. Please put your hands together for him. We also have representing the Honorable Commissioner for Youth and Social Development, Mr. Mobolaji Ogunlede. He is represented by the State Youth Ambassador, Ambassador Obadari Adeneko. Please put your hands together. So, Mr. Tony?
Okay, thank you so much. Thank you most especially to Professor Taiwo Latif Ashe. Thanks indeed for breaking it down. It's not now that when they talk about mental health, everybody thinks that the person is a madman. And I was so happy when you said that almost all of us have mental health. But unfortunately, I was sitting with the editor of Vanguard. When he said that, look at your neighbor and tell him that. So while they were looking at their neighbors, I could not look at my editor. How do I tell everybody has mental health? But honestly, I think that Professor just did a very good job on this. And I was in everything. I think all of us are going through a lot of this. I'm bringing it back to the Vanguard, at least the people who are in the Vanguard of this. I think that we really need this, and we really need to tell ourselves, the truth. The editor could not look at me because he knew what he suffered from. And there are so many of them, a lot of people, at least within the confines of Vanguard, the people that are really suffering, they do not know exactly what they're going through. But I think today now the Prof has just told us it's not madness. It's something that we can say. It's something that we can stop. We can stop help a lot of people, who are going through this mental problems. Because a lot of things are happening. But there is only one thing that I want. If indeed there is a way we can bring Prof, I do not know whether Prof knows Oshodi very well. Prof, I think this thing should be organized in a place where it is most needed. Because a lot of people. I remember when my brother first came to Lagos. He was coming to Lagos for the first time, and of course he came to Oshodi. We're just from the eastern part, and of course you never see where a vehicle will be moving and somebody will be running after it and be shouting. So the man was shouting. The vehicle was moving and he was running. So my brother was shouting, no Bunyara, no Bunyara. Hold him, please, he has gone mad, hold him. But that's he has to make his living.
and a lot of people go through a lot of stress. And when you do all these things, it is okay. I will just round up. I'm just saying, just to say a very big thank you, most especially to our health desk, Shola and Chioma. They have mental problems. If not, I don't think there's a way they'll be thinking about organizing this. Okay, thank you so much.
Thank you.
Thank you very much, sir. Thank you. Okay, because we're pressed for time, we have to move a bit more quickly. So to deliver a presentation on building trust, how strong regulations improve access to mental health treatment, may I quickly welcome Dr. Ramatu Momodu, who is the Director of Narcotics and Control of Substance, ably representing Director General of NAFDAC. Please put your hands together for me.